Our doctors consistently outperform national averages for both weight loss results and complications. We believe the factors for patient success involve commitment from 4 parties: patient commitment, family commitment, hospital commitment, and physician commitment.
Part of the approach to weight loss is a team approach, and that's what we do at the Surgical Weight Loss Center of Utah. Without each of those functioning together as a team, the weight loss results for you will be suboptimal.
The first factor in patient success is the patient commitment.
When a patient decides to have bariatric surgery, they need to make certain commitments in their own life, and these are the most important factors in determining success.
One of the commitment we expect nutrition-wise is that patients eat 3 small meals a day, consuming about 4 to 6 ounces per meal. We ask patients not to drink with meals. Liquids tend to empty from the stomach really quickly, and so if you mix solid food with liquids, it makes the solid food empty more quickly, so you need to eat more.
And there is supposed to be no snacking. I tell all my patients there is no such thing as a healthy snack.
And then avoiding things like big glasses of mocha frappuccino or orange juice that can have a day's worth of calories in one glass, but really don't make you feel full. After surgery, we want patients to be able to eat to live rather than live to eat.
The nutrition commitment involves 3 4 to 6 ounce meals a day. Avoid snacking. Avoid high-calorie liquids, and do not drink liquids with meals.
Patients really have to be committed to changing what they've learned all of their life up until that point. It's a sea change, and it's really important to start making those changes even before surgery.
The next thing we ask our patients to do is exercise. Now, many people have been lied to throughout their life and have been told that exercise leads to weight loss. But the truth is, exercise only leads to weight maintenance. In other words, the diet that we tell you to follow will allow you to lose the weight. The exercise that you perform will allow you to maintain that weight.
Going to support group is really important. You know that patients who go to those tend to do better.
Take your vitamins. Many of these surgeries result in rapid weight loss. Oftentimes, the nutrition is suboptimal.
Taking multivitamins is important. You're not eating a lot, so you want to make sure that you're getting the nutrients that you need to be healthy.
Follow up with your physician, and that's because when you follow up with us, we know the problems that you experience and we can help you get through them. The most important part about surgery is the commitment the patient makes to change. None of these surgeries are a magic bullet. None of these surgeries are easy to maintain weight loss with. However, all my patients tell me that if they make the commitment to change, that the weight loss is possible with the aid of this surgery that they could never have done on their own.
The wellness commitment includes exercise at least 30 minutes a day, 5 to 6 days a week, attend support groups, follow up with your physician, and remember to take a multivitamin. The second factor in patient success is the family commitment.
There are 3 things that families need to commit to do to allow patients to be successful. The first one is committing to changing the environment in the home so they're not tempted to snack.
They need to focus their activities less around food, try and work on other sorts of activities, just celebrating time being together with family and friends as opposed to centering the activity around food.
When patients don't have strong family support, they end up snacking or they end up drinking their calories. And when that happens, they fail long term. Most of the surgeries will allow you to lose weight in the short term, but long-term commitment to weight loss has to be made by the family as well as the patient.
And when patients' enthusiasm or willpower is flagging, patients or families can really contribute and kind of boost them back up, keep them going, keep them motivated.
The second one is to allow them time to exercise, and the third is to allow them time to go to support groups.
The support groups are a combination of things. We generally try to provide some sort of follow-up education, whether it be about diet, exercise, whatever else. But it also is a time for patients to get together and share their experiences. A lot of times people have been struggling with different issues, or they're experiencing something, they're not sure if that's normal, they're not really sure how to deal with it. And hearing and learning from other patients can be as valuable as anything else.
The family commitment involves having a new outlook, including purchasing foods that support the patient's new lifestyle, allow the patient time to exercise, and encourage the patient to attend support groups. The third factor in patient success is the hospital commitment.
We really evolved as a complete multidisciplinary program. We wanted to do that from the outset. We wanted to provide the education necessary, but also the support so that after surgery patients could be successful.
The hospital has made a commitment to have exercise specialists on staff and dietitian specialists on staff. In addition, we have specially trained nurses in both the floor and the operating room.
We have specially trained personnel who are equipped to deal with the special needs of the overweight population.
A hospital that doesn't do all this will have suboptimal outcomes, and as we partnered with the hospital, we've achieved great success.
When I started the Surgical Weight Loss Center, the hospital was a big component of the whole program, and we've worked from the ground level to get things up and running. Part of that is that we are now what's called a Center of Excellence.
A Bariatric Surgery Center of Excellence is a designation given by the Surgical Review Corporation of America. It signifies that the surgeon and the hospital have teamed together to achieve very good results in terms of weight loss and low complication rates.
So the Center of Excellence really evolved as a means of addressing quality issues and making sure that patients did well, that the surgery was done well, the complication rates were low, and the success was good.
Hospital commitment. We offer the only complete multidisciplinary team in the Intermountain West, and we've been designated a Bariatric Center of Excellence. The final factor in patient success is the physician commitment.
We've been consistently able to beat national averages in both weight loss and low complication rates because we specialize in only bariatric surgery, and that allows us to focus all our energies and attention on being the best at what we do.
Because Dr. Kahneman and I are committed to doing pretty much all weight loss surgery, we can really make sure that our patients are getting the benefit of all of our efforts as well as those of the rest of our team.
This means that we are on the forefront of all the trends and newest innovations in bariatric surgery.
We have been involved in various kinds of clinical research. We continue to educate other physicians who are bariatric surgeons and helping them learn new techniques. We also are involved in some basic science research and trying to kind of understand the genetics of obesity and weight loss. We're kind of a package deal. So if Dr. Kahneman is your doctor, I'll be your assist, and if I'm your doctor, Dr. Kahneman will be my assist, and so you really get the benefit of having two surgeons operating on you.
One of the reasons why Dr. Richards and I have been so successful is that we do almost all our cases together. This allows familiarity between us. So literally, she knows exactly what I'm going to do at every step of the procedure, and I know what she's going to do at every step of the procedure. And if you ever would watch us on film, you would never know who's operating because we do the procedures so much alike.
We know in laparoscopy, having an extra set of eyes can be really important, kind of a check mechanism to make sure that you're seeing what you're seeing and doing what you want to be doing.
We're the best choice for weight loss surgery because we specialize in only bariatric surgery. We have a complete multidisciplinary team, and the hospital has made the commitment in order to achieve optimal success.
Physician commitment. Our physicians work exclusively in the field of bariatrics and are dedicated to research. Our physicians focus on improved surgical outcomes and long-term successes, and there are typically 2 bariatric surgeons with each surgery. Thank you for watching this weight loss seminar. This is the first step on your path to weight loss. Thank you for your time and good luck on your weight loss journey.